This is a video at proceduralist.org, and I'm Jason Williams, and today we're going to go over ultrasound-guided lumbar puncture. Ultrasound guidance lumbar puncture is becoming increasingly popular, especially after a BMJ meta-analysis in 2013 noted that ultrasound increased the success rate, reduced the number of needle passes, and decreased traumatic taps in patients. Though it's not mandatory to use ultrasound as the standard of care, especially consider it in situations where it's difficult to palpate the spinous process, including morbidly obese patients, as well as patients with severe osteoarthritis and osteophytes, ankylosing spondylitis, kyphoscoliosis, and previous back surgeries. These patients almost always needed fluoroscopic guidance in the past, but now with ultrasound we can perform these safely at the bedside. Ultrasound can be used upright or in the lateral decubitus position. The choice of probe will vary. The phased array probe has deeper tissue penetration but lower image quality, and it's optimal for obese patients. The linear transducer is preferred, but it only gets shallow images but at a higher resolution, is really only optimal for normal weight patients. After choosing a probe, you still palpate the iliac crest to identify the approximate location of L4. Apply the transducer around the L4 region in a transverse orientation as seen here on the image. What we're looking to identify in the transverse orientation is the spinous process down the midline of the back. This red box will simulate the linear transducer's orientation on the spine. And here's what we see in that orientation. In the middle, there's a hyperechoic line that we're highlighting here, and that's the spinous process with posterior shadowing. Because sound waves don't travel through bone, you just see the cortical bones echo reflections and have a dark shadow behind it. The important thing is to line up that spinous process exactly in the midline, and that posterior shadowing helps confirm you're looking at the spinous process. Once you're sure the spinous process is lined up in the middle of your image, that means the spinous process is in the middle of your transducer probe. Wipe off the gel above the transducer and make a mark with your surgical marker in the middle of the transducer probe. And now you've just marked the midline of the back where the spinous process is lined up. Once you've marked the midline, now rotate the ultrasound probe 90 degrees and you'll be in the longitudinal orientation. We're now looking to identify the gap between the spinous processes in which we want to insert our needle. This red box represents the linear transducer probe looking for that space. And here's what the image looks like. Again, we see hyperechoic spinous processes, and in between is the intervertebral space where we'd like to insert our needle. Again, you want to line that intervertebral space in the middle of your image. And when the intervertebral space is in the middle of the image, that means it's in the middle of the transducer probe, and you want to mark another line on the skin perpendicular to the transducer probe. Now you can join the two previous marks you've made, and where the lines cross, the one vertically in the midline and the second across the intervertebral space, X marks the spot. And this is where we'll insert our spinal needle. One more time, place the transducer in a transverse orientation on the back. We'll be looking to identify the midline in the transverse orientation. Again, your spinous process will be hyperechoic with posterior shadowing, which is highlighted very well in this image here. And you want to get that spinous process in the middle of your image, and that will put it in the middle of the transducer probe, and you'll be able to mark the skin in the middle of the transducer probe. Now that we've identified the midline, rotate your probe 90 degrees, and we'll be looking for the space in between the spinous process to insert our needle. And here you can see two hyperechoic lines consistent with cortical bone with posterior shadowing, and it's the space directly between that we'd like to insert our needle. Once that space is in the middle of our screen, that means it's in the middle of the transducer probe, and we take our surgical marker after wiping off the gel adjacent to the transducer and mark a line perpendicular to the middle of the transducer probe. And that's it. It's not an advanced technique. It takes some practice to get used to, but it's a great additional skill to have for those difficult lumbar punctures.